Last chance, only 1 week left. Don't wait. No, we're not talking about a great sale at your favorite store. We're talking about purchasing a product that could cost you even if you don't buy it. Here to unravel this riddle is Doug Bennett, Director of Individual Health Plans at Medical Mutual of Ohio. So, what is it we're talking about?
So the deadline we're talking about is the primary audience is individuals and families under the age of 65 who don't have coverage through an employer. It's the Affordable Care Act open enrollment deadline. It's January 31st. You need to purchase your coverage or make changes to your existing coverage by that date.
Okay, so what happens first if we meet the deadline?
So if you meet the deadline, everything's in good shape. Your coverage will start on March 1st and you'll be set for 2016.
Okay. What if we miss the deadline? What happens then?
So this is where the story doesn't get quite so good, right? If you miss the deadline, there's a good chance that you're going to either be stuck, and when I say stuck, with the plan that you had last year, you don't have an opportunity to make changes if your needs have changed. And the bigger concern is for people who would be new to the market that were looking to get coverage for the first time. They may very well be shut out from making any changes till or getting any coverage until 2017. There are some unique circumstances called these special enrollment periods, things such as having a baby or getting married, that may allow you to get the coverage, but those are the exceptions, not the rule. And then the worst part of the whole thing is if you don't get this coverage, you're going to likely be subject to a tax penalty because the Affordable Care Act has this individual mandate that requires everyone to have qualifying health insurance.
Okay, if we miss it, what's it going to cost us?
Well, it keeps costing more year after year, right? The penalty started out small back in 2014. Last year, as an example, the penalty was $325 for every uninsured adult or 2% of your household income. 2016, much higher. It's going to be $695 per uninsured adult or 2.5% of the household income, whichever is the greater of the two, actually.
Holy cow,
yeah.
That's a big penalty. So, but what if you're having trouble affording health insurance?
Well, the good news is subsidies are available. They've been available since the inception of the Affordable Care Act, and individuals are surprised to find out that they're eligible sometimes. We've seen numbers that indicate as many as 9 million Americans last year missed the opportunity for a subsidy that could have qualified. So we encourage folks to go out and take a look at their options, make sure that they're looking at every opportunity they have for their subsidies, because it really can help defray the cost of the premium.
So how much income can you have and still get a subsidy?
So individuals between 139% and 400% of the federal poverty level will qualify for some premium assistance.
Okay. Well, it sounds all really complicated. How do we figure this out?
so there's many options, right? Most people at this point have heard of healthcare.gov, and that's a site where you can investigate your plan options, qualify for your subsidies. I recommend you go talk to someone who's an expert in the field. Independent insurance brokers, they can help you with both your benefit choices and to see what you qualify for, or call your insurance carrier. Medical Mutual, we've got a couple of options. If you want to go straight to our website at medmutual.com, you can do all of that yourself, or you can call a licensed sales agent. We've got them standing by on the phones, and they can help you again with both plans and premium assistance.
But don't miss the deadline, right?
January 31st. Please don't miss the deadline.
Okay. The clock is ticking. You have 1 week left to enroll for health insurance for 2016, so don't wait. Follow Doug's advice and begin looking at your options immediately. And if you need help, use the information that's coming up next. My thanks to Doug for joining us today.
Thank you.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com/2015 options, or call 1-866-488-3266.